Good afternoon, ladies and gentlemen who have joined us on this Dr. Fundi channel via multiple social media platforms, via Facebook, via YouTube, via Twitter, via Instagram, and also via the Dr. Fundi website. Welcome. We have a very interesting program in prospect. Today, we have a special guest. Our special guest today is Professor Ramneek Ahluwalia, who is the CEO of Higher Health. Now, Higher Health is, I just call it an agency of the Department of Higher Education. Its mandate is to look into the health, wellness, and development needs of all students and other stakeholders in public universities, in technical colleges, in vocational colleges, in private higher institutions, and also in work and skills-based learning institutions across the country. But we'll hear more from our guest about the mandate of Higher Health. But a little bit about Prof. Ahluwalia. He's a seasoned, trained, and qualified physician who obtained his MBCHD or MBBS. He's also got an MBA from UCT, and also he's got a PhD in public health. So he's appropriately, positioned to be the one who leads, Higher Health that is focused on ensuring that those people who are, either students or, lecturers and other stakeholders within that environment are kept healthy and well. Besides him being a qualified physician, he's also a health systems policy and management specialist. He's also a professor of practice with the Faculty of Health Sciences at UJ, University of Johannesburg. He's written many publications, articles, opinion pieces on public health, HIV, mental health, universal access to healthcare, and many other, topical issues. He's built a number of significant diverse health programs in both developing and developed, countries. He serves in a number of boards of various government and non-governmental organizations. And he served as a health expert on the South African delegation for BRICS Academic Forum. He is a speaker of note in conferences, forums, symposiums across the world, and he's also not, he also actively interacts with local international media. All right, so that's about our guest, Prof. Ahluwalia. Prof. Ahluwalia, welcome to the Dr. Fundi channel.
An absolute honor, Dr. Fundi, and it's a huge and good afternoon to everyone. Thank you.
Beautiful, beautiful. So, Prof, I've read your brief bio. I've also said a little bit about Higher Health, but it's always better to hear from the man who is, at the helm of an institution. Can you just tell us briefly what Higher Health, as an organization, what is their purpose of existence?
Dr. Fundi, to be very honest, South Africa is a country where we have a huge need for our economy to grow through the form of new development of skills built up in this country. And our skills are built up right up to the schools, from our universities, our technical and vocational colleges, our community education colleges, our private higher education institutions, our skill-based centers, work-based learning centers. Yes. So the biggest important element for us is how do we ensure that there is a return on investment on our skills from our government perspective, from our composition perspective. So Higher Health is an organization that basically looks into student health and student well-being across any institution or campus across our country, whether it's in a rural area or it's in an informal settlement or it's in formal areas. And it's very important that we understand that South Africa, even if you are grade 7 and you were a school dropout and you could not find yourself a place in a university, or you could not finish your matric, can still go to one of our skill centers, whether it's a community college. If you're grade or 8 onwards, you can go into our TVET colleges. The aim is to build skills, which gives you chances for employability and are able to create an economy both at a micro level and at a macro level. And I think our
Yes.
biggest focus of work is how do we prolong the lives of this longevity of life and healthy living among the young people.
Beautiful, beautiful. So you are basically saying, as a country, the government and the parents are investing, to make sure that the country has these skills, in the near future. But there are risks relating to, producing those skills. And one of the risks is the health risks, and so you guys exist to mitigate that health risk so that those who come in um, finish without having to drop because of some of these health risks.
No, I fully agree with you. Again, we are a country which with the reality is we have inherited a very difficult past. We are
Yes,
just a young country. We're just about 26 years old as a nation. We have a huge population from a very disprivileged background.
yes,
And unfortunately, we're also a country where we have poverty-driven diseases. We have youth epidemics. We
yes,
are a country which has the highest burden of HIV, and HIV is predominantly a youth epidemic country.
yes,
It's a youth epidemic. It comes
yes,
into the ages of very young people
yes,
um, through unprotected sex and many other factors that we will discuss.
yes,
Parallelly, we are also a country where we have a massive social challenges like the sexual and gender-based violence.
yes,
We have almost every element to worry about when it comes to youth due to the kind of division we are in a country as such. We have
yes,
two South Africa predominantly living in the same South Africa. We have
yes,
a South Africa which is very, very disadvantaged, and real South Africa is big. And we
yes,
are building a nation by giving an opportunity in skills development to this South Africa. And
yes,
when this South Africa comes to a world which is undiscovered towards a reality of living, gets
yes,
grappled into many more health and social challenges. And I think
yes.
it's a very sensitive time that we build our nation together.
I agree with you fully. Now, the majority of the students that are coming into, higher education are late adolescents, majority, or, young adults. Some of them are leaving their homes for the first time. Somebody comes from Limpopo and they are admitted to UCT or to Durban, the institutions there. So in some cases, the adjustment could be quite a serious problem. What are the kind of issues that you see amongst these young people? And we're not going to the specifics. I'm talking about issues around peer pressure, and other things. Before we get to the actual, youth epidemics, we'll get there. But just an average young person who is getting into a tertiary institution, can you just give us a picture of the kind of, challenges at a personal level that they face in terms of decision making, in terms of, being able to withstand peer pressure and experimentation about this and that. Yeah.
Absolutely. And thank you, Dr. Fundi. First of all, also wanted to inform all our guests who are listening to us or listeners that higher education is a misnomer to universities. And when I speak about the peer pressures and challenges, I'll also speak about most of our TVET campuses, which are predominantly in rural areas, or say in our communities embedded into it. I'm
yeah,
also going to speak about our 1,800 community colleges that are around this country, whether it's a Springbok, Bizana. So when I speak to you, it's not going to be just UCT or a
yes,
UP, which is predominantly a very small section of a whole post-school system that
yes,
higher health works in. So you're absolutely right. Imagine a life coming out of parental guidance. Imagine a life coming out of guardian control into this unbound freedom, into this adulthood, into this new environment where they have to survive by themselves. And then they
yes,
into with this tender age into this into our institutions, into our campuses, where there is a lot of peer-to-peer influence. There is a lot of drugs and alcohol, and I'll show you some stats around it. And there's a very high chance when you are as a young man or a young woman trying to come up into this adulthood, and you have a very high to some systemic things that you will encounter. So a poor student, say from a rural town in Eastern Cape, tries to find a way into East London to come into one of our university, and comes into Buffalo City to find a space. I'm just giving an example.
yes,
And here he or she is poor. She doesn't have money. The first years are taking time to come out of residences. This student is trying to get into the residences. There's very little investment money into around her. And the reality is South Africa is poor. Then there comes the peer influence, the stressor of education, the challenges that grapple around this young life. And the
yeah,
aim is, how do we survive this life in this difficult time and make sure that the future, because the future is not these 3 years, the
yes,
future is the next 50, 70 years of beautiful life of growth,
yes.
success, and a family who's going to depend on this individual to come out. So Dr. Fundi, it is a very sensitive part of our future as a country. And if we work on this future, we might have a South Africa which is fully transformed. And maybe the things that we experienced, which is broken families, and no parental guidance, most of our families are born in such structures. Maybe the next generation might be structured and have children who go through schooling education, go through a proper system. And that's exactly where the aim is.
All right. So that those are all the inherent issues, with this person who's transitioning, to post-school, education. Now, I just want to have a sense, how do you as higher health interface with the institutions to drive the programs that you have developed, at the center, at the strategic level, based on the needs on the ground? How do you interface to make sure that the institutions themselves are actually implementing effectively those programs that you've come up with?
So, sometimes we as South Africa say policies are written very well, but never implemented. But the
Yes,
first aim is to write policies, and write policies which are well consulted. So higher health plays a very significant role in towards building policies and building guidelines, and towards an extreme of from taking out a policy and saying this is what we want to do, and system for measure work that happens at a very national level, supporting the minister, supporting the department chancellor, supporting the principals towards putting systems and controls in every parameter which relates to health and wellness parameters around. And
yes,
that's a very systemic part that higher health does. Then the
yes,
other part higher health does is higher health also puts capacity building and training programs, not only for the management, but for the frontline workers, for our student support services around the country, and build systems with them so that they understand how to take care of a young life which is coming into our campuses when it's coming with unique demands of health, wellness, and social issues around.
yes,
Let me lastly, we also run curriculums. We've established curriculums on all these youth epidemics that we will discuss, social challenges, mental health, and both in classroom and out of classroom. We run curriculum, which is like an extramural, where students come into learning HIV, learning TB, learning sexual reproductive health, and any student who goes through our curriculum then eventually also does a risk assessment at very early stages of their life to all these diseases. And as soon as they do the risk assessment, they are identified into high risk, moderate risk, or low risk. These are WHO standard templates of work. And then the
Yes.
other part of high risk linking them to services. So
Yes.
services right from testing programs, ARVs and medications, contraceptives, mental health, psychosocial support services, justice support, social support. So right from education, systemic challenges, capacity building, putting curriculums, risk profiling of early students, and then linking to service. So it goes into a whole comprehensive
Yes.
programming.
Now, I do a lot of work with employers. Now, one of the things I pick up, I mean, some of the big employers, blue chip companies, they've got programs in place. But you find that the utilization of those programs by the employees isn't at the level that you expect. Considering that there is this investment, man, that is at workplaces. But when it comes to your constituency, how is the uptake or the utilization of these programs? Because people, when they have not yet experienced health challenges and stuff, they may not necessarily see why they need to attend the curriculum that you're talking about as an extracurricular activity. So, how do we create awareness and show them the benefits of making use of the programs that are there at institution level?
You know, when we started in 2010, this whole changes of building programmatic deliverables across campuses, we had the same question: will students join? And these are young people; it's up to them, and they only
Yeah,
want to go to the clinic when it's a bit too late. But you'll be
yeah,
surprised, Dr. Fundi, 1 million young students, and I repeat, 1 million young students pass through our system every year, which is part of
beautiful.
higher health, which is through our curriculums, through our risk profiling, through our
Yes,
service provision.
yes,
And I'm telling you why this is 1 million is because if I go out and asking, and through you, I'm going to appeal that the first years are coming and I want higher health ambassadors, I
yes,
want peer educators to be formulated. I can tell you just one circular, and I have a huge recruitment drive where students want to join this. The reason why is they are coming from families and communities who are suffering with these pandemics. They have
yes,
seen their parents, they have seen bereavements, they've seen their brothers, their family members dying of HIV, being seen gender-based violence. Some of them have experienced GBV when they're coming. Most of them have experienced these problems even before they enter the system. So they want to champion
yes,
this in their own
yes,
communities. And nothing better than an educated young South African to build South Africa from understanding this through his heart and passion and take it forward to its peer to peer influence. So I am telling you, I on the other side, my
yes.
challenges are I've got a lot of them asking, and we are finding more provision of space on the other side. I think it's
Yeah,
predominantly because of the community.
beautiful. I'm happy about that. Now, Prof, a few days ago, you released, we are friends on Facebook. So you recorded and recently released a video that is meant to be played at all the institutions within, the area of influence of higher health. Now, can you just talk briefly to us about the purpose of that video? I've listened to it, but just for the benefit of our viewers, because we're going to go deeper on the contents of that video, but just the purpose of that video.
Dr. Fundi, unfortunately, we actually release this in January, but this year, due to our metric results coming late, our universities and colleges are only enrolling the first year students in the month of March. This
Yes,
is a routine for orientation month.
yes,
And orientation month is when the first years are coming, and
yes,
very importantly, to speak to their parents and their guardians, because they go through an induction program before they join the tertiary system. Whether you are in a community college in a rural area or you are in a UCT, every student goes through an induction program. And that's
yes,
very important part of this video is to reach out to these 700,000 young South Africans that are joining our system. Every
yes,
year we have 700,000 leaving the system and about 700 to 800,000 joining our system. It is to reach out to them in this 1 month to say, these are the youth epidemics, which we will discuss. These are the problems. These are the things that are going to be around you.
mm,
What kind of services are available?
mm,
You can or very highly be vulnerable and might get into the grapple of these social pandemics and health pandemics, and where to seek help. And
yes,
most importantly, to encourage them to join our curriculum, our classes, become peer educators, run the peer-to-peer program, and where to find these services around it. So that's the whole purpose, to reach these 800,000, sorry, 700 to 800,000, which is our variable number that we go
yes,
and want to appeal to everyone joining the system.
yes. Okay, so the video will be played, at every institution as part of the orientation program. Prof?
Yes, Dr. Fundi. Every
Oh,
campus,
all
whether
right.
rural, in urban, it will be played.
Yes. Now, at the beginning of the video, you try to make them understand. You first congratulate them for making it to the post-school, education, having passed, their secondary education. And then you make them understand their role in the economy, their role in the future of the country, the fact that they are the hope of their families, and they are the hope of the country and maybe the continent of Africa. Yeah. So just, why did you start like that?
Dr. Fundi, the reality is this is the honest truth. Um, if I'm talking to as my own example, I look after my brother's children, my sister's children. My mother keeps asking me everything because I'm an educated South African,
Yes.
and the economy of my family is dependent on me.
Yes.
And the reality is, it has taken them very hard, for your parents, for their guardians, for they themselves, fighting a very difficult system in poverty, in difficult challenges, and making it to the tertiary system. And
Yes.
this is a system where gives them an opportunity to get a job. Whether
Yes.
you are going to be in fishery industry, in the fisherman, or a mining industry, or agriculture, or a waitress, or a hospitality, doctor, engineer, any skill will come from higher education.
Yes.
And this is again a very sensitive time of their youth. So the
Yes.
first aim is to congratulate them. They have done very well. They've
Yes.
fought the difficult part and they've come to this stage. But the
Yes.
next stage is equally difficult. And then
Yes.
to encourage them that this is the time, if they pass this new 3 to 5 years of their lives in the
Yes.
most appropriate way, in the difficult way. It's not going to be easy
Yes.
financially, economically, stress wise, and the vulture things that will move revolve around them. But
Yes.
the aim is to get them survive this out.
All right. And then you go into the youth epidemics. Let's talk about these youth epidemics, the social and health youth epidemics.
Dr. Fundi, first of all, the first big epidemic is an HIV epidemic. As much as COVID has taken us completely over it, but the biggest challenge on an epidemic that we currently facing is HIV. 8 million South Africans live with this pandemic.
Yes.
15 to 24 age group is the age where new infections come in high numbers.
Yes.
And when we know this, we have to inform them what is HIV, how do we fight HIV, we can prevent HIV.
Yes.
Is any death which is preventable is the most saddest part of us.
Yes.
Even what we experienced as higher education recently with somebody just died at Wits University as a bystander is a
Yes.
preventable death. Even
Yes.
diseases are preventable diseases.
Mm.
TB. If South Africa is the third largest nation in the world with TB pandemic, and which is very interrelated to HIV, we have to inform them.
Yes.
They live in close residence, they live close inhabitants. We have to inform them how to prevent TB and what to watch out when it comes to TB. Sexually
Yes.
transmitted infections.
Yes.
HIV is sexually transmitted infections, but there are many other sexually transmitted infections. And I am not going to be dishonest with them. This is
Yeah.
their age to enjoy sex. This is
Yeah.
the age they will have sex. They will
Yeah.
make relationships. But
Yeah.
if they can formulate preventive relationships or prevention as part of the relationship, they'll
Yeah.
protect themselves from many other sexually transmitted infections. So, informing them about gonorrhea,
Yeah.
chlamydia, syphilis,
Yes.
and many other for what to watch out and
Yes.
how to take treatment and way to take treatment.
Yes.
Mental health.
Yes.
Mental health is one of the biggest killer. If you really ask me what worries me in higher education the most is mental diseases,
Yes.
educational stress, bereavements, anxiety, depression, suicidal
Yes.
rate. And I'll show you some data. One in
Mm.
fourth student in our higher education is either severely depressed or severely anxious. So if one-fourth of our
Yes.
student community is so much affected by mental health, that's clearly affecting our graduate competencies, our
Yes.
throughputs, our economic sense of what we want returns from them, which means we need
Yes.
to provide them early signs of support in quick
Yes.
so that we can get them back.
Yes.
Unplanned pregnancies.
Yes.
One third of our young girls become pregnant on campus.
Yes.
And the reality is, when they become pregnant, they drop out. Um,
Yes.
and by the time these are young girls, they are 17 years, 18
Yes.
years, sometimes 16 years, sometimes 19 years. As a doctor myself and Dr. Fundi you might agree, maternal health complications in the young age are severely challenging. And by the time they realize, they are already to a stage where they cannot go for medical abortions. They do not
Yes.
have money for medical abortions. And at
Yes.
the end, they start conceiving the young life for a young
Yeah.
mother. So they drop out. And our retention rate from the young girls who become pregnant and drop out to come back into education is almost 10%. So we
Yeah.
lose this intelligent brain that's come for skills building predominantly because of something like contraception and safer sex practices and pregnancies.
Yes.
Issues of alcohol and drugs.
Yes.
60% of our students at times consume or abuse drugs or alcohol, predominantly alcohol,
Yes.
every month in our campuses.
Mm.
And drugs and alcohol is directly proportional to graduate competency, directly proportional to our other epidemics, link it to gender-based violence.
Yeah.
WHO says South Africa is one of the most unfortunate country where 65% of every sexual and gender-based violence is preceded by substance and alcohol abuse. It's directly linked to GBV.
Yes.
It's directly linked to mental health,
Yes.
directly linked to HIV, very high unplanned substance and alcohol abuse.
Yes.
Issues with disabled students,
Yes.
our key population like lesbian, gay, bisexual, human to human respect, but most importantly, COVID now. And very importantly, through my orientation video, I wanted to inform that young people who are at this age of 17, 18, 20, 21 are equally susceptible to COVID as an adult.
Yes.
They might be mildly symptomatic most of the times, maybe asymptomatic or moderate symptomatic. But it's not like they have died of this disease. Young
Yeah.
lives have been Some of these young lives have underlying comorbidities that they themselves don't know at this age.
Yes.
But most importantly, they can be the carrier of this virus to their peer students, unknowingly, to their parents, to their guardians, to old people, to academics, and they might transmit a virus unknowingly to somebody who might not survive this virus.
Yes.
So they need to understand COVID right from the science of the COVID, right from its understanding of prevention of COVID. So,
Yes.
Dr. Fundi, there are many more societal challenges, developmental challenges, and health challenges that
Yes.
together formulate many epidemics. You know,
Yes.
the epidemic is one word that is used in health, but I
Yes.
think sometimes there are social epidemics that we
Yes.
must talk about, which affects health, which affects well-being, and it affects a human in general. And I think the whole
Yes.
aim is to inform these are all youth specific and youth related, which is at this age.
Yes. So you've mentioned a number of these youth epidemics, Prof. You know, you started with HIV, TB, and STIs. And obviously, when we're talking STIs, there are those that are treatable, but there are those that are lifelong. Once you've got HIV, we can't cure it. Once you've got herpes, it's there for life, you know, and many others. And anyway, these things they work like comrades, you know. When one is there, it calls the others, you know. So you've got the HIV, HPV, and many others, you know, coming in, and HPV, you know, predisposing them to cancer of the cervix. And amongst the cancers that affect females in South Africa, you know, the cancer of the cervix is one of the top ones. Amongst the black population, it is obviously the number one amongst females, but if you're looking at the total population, then it's number two after breast cancer. So issues around cancer awareness, therefore, you know, linked to, you know, sexual and reproductive health, very, very important, you know, for these young guys. But let's go back to the issue of mental health, Prof. You know, we are in a country where issues of mental health are still a stigma. You know, some people are reluctant to actually seek help, especially males, because they, you know, we are raised to be tough. We can't show vulnerability. We must toughen up. We mustn't be weak and all of that. And by the time we present, you know, to health facilities, sometimes it's already late. So awareness about the importance of mental health so that people can be able to early identify that, you know, I am decompensating now. I'm highly stressed and I'm getting to a certain point where this stress is getting to a mental illness. So how much of awareness programs to you know, to create that sense that people are able to recognize when they are no longer able to cope?
Dr. Fundi, in fact, I'm going to be selfish today and I'm going to use
Yeah.
your platform to market a number.
Yes, no problem.
0800363636. And I repeat, 0800363636.
Yeah.
I appeal to any young life in the tertiary system. 24-hour crisis helpline. We have seen it with COVID. Many young people, parents, there'll be a lot of bereavements among family members, educational stress, insecurities of the future, gender-based violence remains around you.
Mm,
The reality of mental health is very serious.
mm,
And by the time you end up realizing you're at a stage where you do not know what to do, you
mm,
want to commit suicides.
mm.
Suicide remains the second biggest cause of death in the young people in South Africa and in higher education.
Yes.
Um, so it's 3 o'clock in the morning, 2 o'clock. I don't want any young South African to ever be felt alone or be alone. They can call this number. There are counselors, there's psychologists, social workers, 24 hours, wanting to assist. You need to talk to somebody. You need to get this counseling at an
Yes.
immediate time. You need to speak to someone.
Yes.
And this is not one 5 minutes line. This is
Yes.
a line which makes follow-up till the crisis is over, and
Yes.
then links you to either higher health psychologists or
Mm.
your own counseling unit in universities, or
Yes.
to psychologists outside or other support structures, so that the follow-up care is also done. So
Yes.
from primary care to a tertiary level care.
Yes.
But Dr. Fundi, the reason I started abruptly with a telephone number is
Yes.
because it's not the answer to the problem, but
Yes.
it's a small help at a
Yes.
time where people have left it to too late. And
Yes.
the aim is not to lose at that stage.
Yes.
The minister launched this with us in August last year.
Yes.
Until now, and I know I'm openly declaring a very sad number,
Yeah.
but the reality is 10,000 crises have been managed through this line. I'm
Yes.
talking about 10,000 young lives who dared to pick up this call and spoke in odd hours of the days. I'm
Yes.
just happy they did. And I
Yes.
want more of, and my greed is more. Should there be more? The
Mm.
reason is every life, Dr. Fundi, through you, we can reach out and
Yeah.
keep on advertising this number, can
Yes.
save many more lives. We
Yes.
might not save many, few also, but
Yes.
wherever we have to, we need to keep trying to save. Mental health is very real. If you really ask me where our skills are being killed, where our competencies are not high, just imagine a stressful mind,
Yes.
anxious mind, a depressed mind.
Yes.
How will this person survive into a very high academic performance society,
Yes.
in under competition, under
Yes.
stress of future? The
Mm.
family is waiting for this individual to take over the onus of the family burden and grow. The
Yes.
person has a family to build,
Mm.
coming from very difficult backgrounds. I think this is the most important pandemic,
Yes.
where people need to know this is a disease,
Mm.
this is health condition, this is a real condition. It
Mm.
needs cure, it
Mm.
needs prevention like any other disease. It
Yes.
is not different.
Yes.
The aim is we are the people who are stigmatizing it. So
Yes.
if you have suffered from mental health and you in our higher education become the higher education brand ambassador
Yeah.
and go out to many other peers through our program, because we need many South Africans who have gone through it, survived, and build other people to come out. Because any disease, Dr. Fundi, whether it's HIV, whether it's mental health, whether it is TB, whether it's pregnancy, it needs to be picked early. Because
Yes.
if you do anything early, you can prevent a lot of further damage on your human body
Yes.
by immediate measures. It's better, I speak from kidneys because that was where my subspecialty of work was. I always
Yeah.
say hypertension and diabetes is linked to kidney diseases.
Yeah.
But if I can pick up hypertension early and put on treatment early, the stage to kidney failure will never happen, because the disease was picked early and put on a treatment and follow-ups where the damage to a multi-organ failure or an organ failure didn't happen.
Yes.
It goes parallel to every disease, including mental health. So
Yes.
picking a disease early, and from higher health, we have from 1 million students who come through our curriculum, they
Yeah.
go through mental health risk assessments also. And I
Yes.
want to encourage students to do that risk assessment. You
Mm.
might be worried by when you're reading those questions to say, oh, I am maybe depressed, or I am in the phases of anxiety and it's really problematic. The aim is not to scare you.
Yes.
The aim is to link you to a service and make
Yes.
you recognize a disease that you
Yes.
can take care and early prevent it from further damages.
Yes. And that number 0800 36 36 36, it's a toll-free number, right?
And sorry, it is totally free. It is
It's,
a
yeah.
fully toll-free number.
Yes.
Absolutely.
And the guys who are picking up the calls are registered professionals who have signed confidentiality, as part of their, confidentiality and other ethical, professional responsibilities as part of their work. And therefore, what you share with them is not going to go to anybody else without your consent. Because sometimes people worry about, will this information I share there, be used by other people whom I may not have consented that they get information. So I'm just trying to reassure, those who are watching, or the parents who are watching, to say, my child, should you experience, a lot of stress and stuff, do use that line. And by the way, like Prof said, there's psychologists, there's social workers there, and they are bound by their professional standards to actually keep the information, confidential. Yet, obviously, depending, on the severity of the problem, they may even have to refer you further, depending on the nature and the severity of the problem.
Dr. Fundi we work with South African Depression Anxiety Group, SADAG, a very professional engagement. There are counselors and psychologists and social worker, a team that works together on every call or individual. And these are not from their education, these are neutral people. So, and you're absolutely right. Confidentiality is part of health profession. And any health profession maintains that and takes oath on that regard.
Yes. Right. I'm going to come back to the issue of drugs and alcohol, Prof. The issue of drugs and alcohol, because we are in a country where, I think our relationship, and I'm here not trying to be a judge or judging people, but we have seen during this COVID period that as a country, a significant percentage of South Africans have an unhealthy relationship, with alcohol and sometimes other substances. And you mentioned that 60% of abuse, the 60% of levels of abuse, and about 65% of GBV cases are preceded by use of alcohol or drugs, which then means if we need to make a dent on those issues of GBV and any other problems relating to alcohol abuse, then we need to confront this issue. We need to confront the issue. And I am thinking here about a 17-year-old who managed to get enough NSFAS, funding, and they all of a sudden have got money that they have never been able to have, and some of them then they abuse that money. I'm not saying all of them they do. Some of them abuse that money and they buy alcohol, and the parents are not there. Parents are very much, at home somewhere, and the peer pressure is rife. They want to belong, and then they get hooked on drugs, they get hooked on alcohol, and obviously that affects their education. So as far as issues around substance abuse, do you, just like you've partnered with SADC when it comes to mental health, have you partnered with any other organizations, your Sankas or organizations like those, Alcoholic Anonymous and things like those, as part of your program?
Definitely, any disease or any social challenge, higher education is just a microcosm of a bigger society. We cannot fight this alone. For example, gender-based violence, we cannot fight it without SAPS, Department of Justice. We cannot fight it without social development, health. We have to fight it as a family jointly together. I'm not talking about government alone. I'm talking about NGOs and I'm talking about private sector. And it is a collaborative effort. And I'm keeping private sector specifically in this because they are the biggest recipient and beneficiary of our system. And to be very honest, and the biggest, in fact, private sector writes to me all the time. And we have a very serious discussion around the fact that their main aim is productivity modeling towards higher productions in their private sector, which is fair. But they can only happen if their skills are living longer. It
Yes.
takes long for them to recruit somebody and groom somebody into a job, and then losing that person, which is no, and then starting the whole process again.
Yeah.
But that experience can take the production to another level. They're clear about it.
Yes.
So similarly, when we come to drugs and alcohol, we cannot fight this alone. First of all, we are not saying ever, I'm not in the favor of saying zero alcohol
Yeah.
or alcohol free zones. No, it's all about responsible drinking. These are
Yes.
adults. We're
Yes.
talking to 18 years old, 19 years. For those who are still in their late teens, my humble plea is not to even go that direction, because by law, it is 18 and plus who
Mm.
should be consuming alcohol or buying alcohol.
Yes.
And we do have some in our system who are in the late teens and adolescent, and for them, it is absolutely zero alcohol because that's by law. But
Yeah.
the predominant population, which is about 90% of the population, is above 18 years.
Yes.
And when in this population, responsible drinking, and that is where the partnership and social compact comes
Mm.
between institutions, higher health, and the students, and the parents, and the guardians towards this element called alcohol and drugs. Not
Mm.
only they're going to kill and destroy their future in the peer-to-peer influence, or and you're right, little bit of money, peer pressure, peer-to-peer influence, adulthood, naiveness, uh, out of parental control, unbound freedom. These are all reality features towards slightly moving the person towards alcohol and drugs. And
Yes.
the person doesn't know how to stop when the influence is around you. And
Yes.
that is where the abuse happens very quickly. So
Yes.
the referral systems to Sanka, our own psychologists, our systems are all there. And there's also risk screening on substance and alcohol abuse to early detect abuse and early detect addiction to the individual.
Yes.
But we will not win this without the social compact and insight from parents and guardians on and the students themselves in
Yes.
controlling this pandemic. So every organization for referral is there, but
Mm.
the first aim to win this is from the student bodies themselves. And I work
Mm.
very respectfully closely with the SRCs. We
Yes.
have a whole program with the SRCs to make sure that all these things I'm speaking, and specifically drugs and alcohol, be part of their day-to-day engagements. Because
Yes.
at the moment, the leadership needs to stand firm in these issues predominantly for us to win this.
Yes. Right, Prof. Now let's move on to, I think we'll touch briefly because we'll then spend a few more minutes on COVID and the vaccinations, right? But just one area, the area of non-communicable diseases, which is one of the youth epidemics as well that you touch on the in the video. Yeah,
I,
let's
I,
just
I,
yeah.
as much as always, we spend about, and I'm so grateful that you picked it up. Maybe your medical profession helps us so much to reach out to people around this, because every time when I engage on these issues, HIV takes predominance, and so is the issues of gender-based violence among sexual reproductive health issues, which is
Yeah.
undoubtedly the biggest epidemics in youth. But you're right, the world is changing, and lifestyles have changed drastically,
Mm.
and we have started seeing an enormous rise of non-communicable diseases among the young people, and that's the reality. And this is where it starts.
Mm.
It starts when it comes to obesity leading to diabetes, uh, as you rightfully said, HPV leading to cervical cancer, understanding of breast cancer, just
Mm.
the four quadrants of your breast. We
Yes.
want to reach every young girl in South Africa to understand how to examine her breast while
Mm.
taking a bath or
Mm.
when she is alone in her room, because she can find a lump very quickly if she
Mm.
understands how to do it. What are
Yes.
the signs of cervical cancer? What are
Mm.
the signs of early signs of diabetes, of hypertension?
Mm.
I'm not exaggerating.
Yes.
We do probably over 300,000 young lives, say blood pressure testing,
Mm.
as part of our caregiving programs,
Yes.
and 10% of students before the age of 22 are now becoming hypertensive or being classified into hypertensive elements, which is
Yeah,
risky, which is trying to give us an indication that non-communicable diseases cannot be sidelined among
yeah,
the young people. And this is where the early changes of behavior are needed for
yeah,
them to have a prolongevity and longevity of healthy living. So I'm glad you picked it up, and I
mm,
just felt it is important that education on non-communicable diseases is equally important as
yeah,
it's for communicable diseases and other social pandemics.
yeah. And obviously impressing upon them the role of regular physical activity and also correct food choices. Those two, being the big contributors towards, being overweight, being obese, and the development of, things like type 2 diabetes or even hypertension. So that lifestyle change of them being physically active. Well, some of them were active when they were at secondary, or high school level, part of the teams, hockey or whatever. Then they get to varsity, then they are not so physically active. Yet that physical activity itself, being involved with that regularly, you produce happy hormones, which in turn help with managing stress. So, those kind of things. All right, let's get to COVID-19, or maybe before COVID-19, the issue of kids with disabilities. Do you cater for them within the program? Here and we always, when we talk disabilities, most people only think of physical disabilities, the limbs, but there are many, types of disabilities. It could be visual, it could be auditory, it could be the gross ones in terms of, the limbs, but also there could be other ones, like somebody who's living with bipolar, a mood disorder, which is a lifelong, type of. So is a focus within the programs to support kids who are living with disabilities.
In fact, I'll go one step beyond it, and I'll say it's not the focus is only for students living with disability, but the focus is into to the entire population to sensitize them that among them are people living with disabilities or
Yes.
young lives living with disability, because the respect that the others have to give to them is very, very important, and that's exactly what we are lacking at this stage.
Yes.
So what we have done is we built a curriculum on disability so that people understand what is disability, how they recognize another human or themselves with disability. And disability is just not the physical disability that we know about.
Yes.
There's a many forms of disability, and if you calculate a whole disability, and I was in one of the forums earlier this week, and I was surprised to say that 17% of our entire South African population has some or the other form of disability which they live with.
Mm.
So the respect that disability requires is very, very critical if we want to save our economy and we want to save our throughputs and competencies into skills building. Now, when I say disability, I am also talking about that disabled people have special needs.
Mm.
And it is very important for us to respect that. And in equally, disabled people then eventually become the highest on risk to gender-based violence, to sexual practices, to forceful sexual practices,
Yes.
to many other mental health trauma, and many other epidemics that I spoke about, which interface with disability importantly. HIV among disabled people is very high, predominantly due to gender based violence and forceful sex and many other parameters that have been experienced by
Yes.
disabled people.
Yes.
Also, people with disability, their needs around accommodation in residences, in special support in bathrooms and toilets. It is very, very important that we are a country that embraces disability with respect. And I think what we want to build from higher health is that respect to disability from one human to the other with the proper understanding of disability across. So the curriculum is not for people with disability,
Yes.
it is for every South
Everybody.
African to
Yes.
respect disability and learn disability.
And I appreciate that they are differently, abled. You know, I mean,
Absolutely.
yeah, somebody may have a visual, disability, but the body always compensates. There will be other, of the five senses, the others will be more than, higher than average. The point I'm trying to say is that the fact that somebody has a disability, doesn't mean there's no value that they can add. Sometimes even better than you who think that you are normally, able. So I thought I needed to just touch on that. Let's get to the COVID area. Now, we have just commemorated the first year since we had a confirmed case on the 5th of March. That's about a few days ago. Now, as higher health, what has been your experience around COVID-19 with, the people within your constituency? I know that you launched a program, I think late April last year, which is a COVID program for post-school education system, which was followed by the support program, which was launched in August, by the minister, something that you've touched on already. Now, when you just reflect on the year that has just passed, difficult year, by the way, what has been the challenges and also the wins, as higher health in terms of assisting, especially as people were coming back and the institutions were reopening? Was there a system that you guys put in place, highly technical system that would allow people to be able to go into the institution or not be allowed and all of that? I just want us to start there. But where we are going is around vaccination.
Dr. Fundi, first of all, let me thank you. I want to sincerely thank you. It was in April that you picked this good practice from us and you brought us onto your channel. And if you remember, we were relayed live on SABC
Yes.
and many media channels around. The
Yes.
reason I'm saying thank you to you is that was a time when we were all finding ways to reach parents, guardians who were all at home worried about their children's academic year. Students were worried about their own academic year. There was so much uncertainty at that moment. The president had put us into lockdown 5, and we knew we cannot continue our economic sense, our institutions in a lockdown phases, and we needed to build a system where we can start opening our systems gradually to build our education year or save the academic year, which is the first phase of the economic sense of moving forward. So I just thought I should really remind the viewers about that, and I wanted to sincerely thank you. And that's why, Dr. Fundi, I will never refuse you if you ever ask me, even in the midnight, to say, come and do something, and I will make sure I will do, because what you did for us during those days is very remarkable. You made us reach a huge amount of our population that we wanted to reach irrespective.
Yes.
So the reality was, Dr. Fundi, was that to save an academic year in a country where we have some privileged universities, say, who can do remote learnings or can do distant learning education, but the predominant sector, which is our poor universities, our disadvantaged universities, our historically disadvantaged universities, our rural sector, our TVET colleges in entirety. There are 800,000 lives that go into just one subsector called TVET colleges. Every
Yes.
year, 800,000 skills go back into the economic workforce, which is the real essence of South Africa. ESCOM, mining, agriculture, every industry is coming, even automobiles. There'll be no Mercedes if we do not build the skills into that
Yes.
sector to work in.
Yeah.
So we had, and these are practical learning courses. You cannot teach practical learning distantly or remotely, you know. So like our interns, our nurse, our final year students or fourth
Yeah.
year medical, you can't teach medicine remotely.
Remotely. Yeah.
So we had to open our system. And
Yeah.
then we started building guidelines, our protocols, our systems, our controls. And we launched through the minister a platform called Health Check. And
Yes.
this Health Check platform is on WhatsApp, on USSD, on web form, totally free.
Mm.
People can do their COVID screening while at home or in their res before into entering the campus. The aim is to prevent congestion at the gates. The aim is to prevent anybody at risk to this pandemic entering into our campuses so that they transmit the virus from the scientific angle
Yes.
and understanding the virus, and they get a green passport on
Yes.
daily basis, which
Mm.
allows them to enter the campuses. If you have thousands and thousands of young lives entering every day into our campuses, we have to put systems because these can be a potential center for outbreaks and
Yes.
cluster outbreaks in a very, very quick way.
Mm.
So I think what higher health did was put up these systems, screening stations. When everybody was at home in lockdown, the team of higher health with the management were building a screening station at the gates till
Mm.
June so that we prepare for the 1st of June when the campus opens, when
Yes.
thousands of students come. And we had built 30,000 frontline workers in
Mm.
just 4 to 5 months that could help in opening our system and putting these protocols and controls towards allowing the academic year to happen with 5,000 student volunteers. And I really want to congratulate those 5,000 young, brave soldiers among our students who took it upon them and came out and built these stations, built this system of knowledge and stuff, along with the 25,000 frontline higher health, the higher education workers. So
Yes.
Dr. Fundi, just to nutshell, there are educational programs, there are screening stations, there are screenings on daily basis, there is a tracking and tracing system, there is cluster outbreak system, exam system. So we got a protocol exam right from before the exam, during the exam, and after the exam. As we speak right now, some universities are still completing their academic year through this exam system. And
Yes.
exams are one potential places for cluster outbreaks, right
Yes.
from how they enter the classroom to the quarantine of the examination papers, the preparation of the invigilators, to the checking of papers after the quarantine of these papers and sanitization of these papers. It goes to a very meticulous, minute details towards preventing preventing lives around us, and that's what kept higher health and its team on its toes and building systems around it before I
Yes.
take vaccination.
Yes. So the community within these institutions, what has been the feedback? Obviously, when you deliver something, you also want to get a sense of, appreciation, value add, and then obviously teething problems here and there that also give you an opportunity to improve.
See, we have lost some academics and we have also lost some students in this period.
Mm.
And it was beyond our control. But what I give back with my happiness is that over 2 million South Africans went through exams, went through classrooms, and went through a system where we could save an academic year,
Mm.
we could save lives, we could put systems and controls with a lot of further damage that could have happened, could have gone to a very difficult situation because we are a very unique sector where
Yes.
thousands of young people enter on day-to-day basis.
Mm.
And I think the biggest essence of some little happiness that we take back is only one point: is we've saved millions of lives through putting infrastructure and controls
Mm.
by educating knowledge generation and putting these controls towards ensuring that further damage could be prevented. Well,
Mm.
the story is just halfway right now. We don't even
Yes.
know whether it's one quarter or halfway. We've got many more waves. In fact,
Yes.
we are in a very difficult times where people might change their behaviors more than they could have changed earlier. So we don't know what's incoming, but the fight is on.
Beautiful. Now, one of the things about this pandemic, COVID-19 pandemic, is that there's been no cure, right? A lot of people have been hoping for treatment, and a lot of researchers have been looking at repurposing of drugs, but to date, there hasn't been really any drug that has been found to have a meaningful impact, including, both ivermectin and the anti-malaria. So it then leaves us with only one option that has been tried and tested, that has led to eradication of very deadly epidemics or pandemics, which is vaccination. Without vaccination, we would still be battling with smallpox, which was eradicated in 1979. Without vaccination, as a continent, would still be battling with polio, which last year was eradicated in this continent. So vaccination, we all get vaccinated as soon as we are born. Our kids, it's part of the education system and everything. So vaccination is a very important tool in the arsenal of fighting diseases. Now, even with COVID-19, when I say we, the medical scientific community has moved with great speed to develop vaccines that are safe and effective. All right. And almost every month, we're hearing more and more information and more vaccines being declared safe and effective. Now, with all of that, vaccination in the country is going to be centralized, or it is being centralized, managed by the Department of Health, National Department of Health, working with the provinces. But I want to have an understanding then, how is the post-school education system going to interface with national government or the provinces to ensure that this constituency, is actually taken care of? And I'm here thinking that, there are those who are healthcare workers, which is phase one. There are those who are essential workers in phase two, or congregate communities. One would say hostels are like congregate communities. And then there's phase three for everyone who's over the age of 18. So I just want to have a sense, what is the strategic approach? And maybe if you can share at a high level, what you are planning to do around vaccination as Higher Health.
I think I first of all echo with you, Dr. Fundi, that one of the only means that we have known so far to eradicate the disease is vaccination. And I'm so glad that you are speaking to the public who's listening to you around, and I have listened to you many times, and you've always been promoting how smallpox or polio, and how we as young people, when we grew up, our parents ourselves were given these vaccinations. I still carry a scar of tuberculin, TB scar, which we call it, in my arm, which we all know is through the vaccination to help us fight these deadly diseases. So this is not new to human mankind. In fact, this is the only route we have to eradicate a small microorganism that mutates or tries to formulate to survive. All the virus is doing is trying to survive in our human body, in its defense. That is exactly what this virus is doing. It moves from one human to the other, starts sitting down and start finding ways to survive. In that survival, it starts killing our human body because it's having a raging of war. But if we have a vaccination that produces already some defense mechanism, the chances of this virus surviving in our body become minimal, because before it starts multiplying or overpowering us, our antibodies overpowers it. And it's a new disease. So I must say that the science across the globe has worked tremendously towards finding which was kind of seemed to be impossible, which was vaccinations, and now they are in access to us. There's a huge outcry for these vaccines. So the Minister of Higher Education has asked myself and the Higher Health to develop the PSET vaccination program and the
Yes.
strategy. I'm also working very closely with the Department of Health, and specifically in a work stream with the Department of Health on congregate settings.
Yes.
And specifically, higher education is a congregate setting. It's a setting where you have so many young people and adults together into one space.
Yes.
One thing we have already done, and I'm very proud to announce, that all our campus clinics and our campus healthcare workers are already trained by the Department of Health towards this vaccination of COVID-19. So we are ready. The
Yes.
question is when the manufacturers start sending these phases of vaccines, which everybody is hearing from the Minister of Health around how these phases of vaccines are coming, we as the congregate setting are ready towards the mass vaccination program, which has to still go in age phase specific. Um, uh, from our perspective, we believe that age is a very big factor for 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 when it comes to when it comes to serious or severe infection versus mild infection. And
Yes.
most of the people who are old are also having comorbidities predominantly because some of these comorbidities are also age related.
Yes.
So as the world and the global norm goes, vaccinating old and aged people first should be the right norm. And our academics, our student affairs, our frontline workers are are adults who are directly exposed to thousands of students. So the
Yes.
first who are carriers of these virus as young lives. So their exposure is so high that our biggest aim of working with the Department of Health is to vaccinate our
Yes.
staff in the phase two. So as soon as the phase one of healthcare workers, then we also have our own healthcare workers, which are already part of the phase one, and
Yes.
they are following the EVDS system of the
Yes.
queue. We are not yet in the queue, but there will be a time when we'll be in the queue and we'll be vaccinated.
Yes.
But on the other side, the I'm talking about community healthcare workers and our nurses and other staff members that are psychologists and stuff.
Yeah.
But I'm talking about is the the phase two, which is our academics and our student support and our resident wardens, our frontline workers. So I
Yes.
think it's sequencing, it's the building the queue system, building
Yes.
the infrastructure inside the institutions, but
Yes.
very importantly, that Dr. Fundi, I want to talk to you about is this infodemic or
Yes.
this fight against this misnomer. And all I appeal as being from my own scientific world and as a layman to inform people that there, and we have repeatedly we have just sent out a circular to all our institutions that there are only couple of dedicated websites
Mm.
where there is authentic information of vaccination.
Yes.
There is only higher health curriculum, which is built with the NICD and the
Yes.
National Department of Health and WHO, which
Yes.
talks about right information of the vaccine.
Yes.
Should you follow ours, or should you follow WHO, or should you follow Department of Health? You'll
Yes.
find a very similar resonating information.
Yes.
Side effects of the vaccine, read it from the scientific world, not from a social media world.
Yes.
Uh, the issues and misnomers about what this vaccine is carrying, 5G and internet and
Yeah.
data and all those kind of infodemic nonsense
Yes.
is, I'm sorry to use the word nonsense because they are
Yes.
nonsense. And
Yes.
sometimes we need to be strong enough and brave enough to use those words and
Yes.
ridicule them to so that the population understands that we are not going to entertain them in that kind of arena. So
Yes.
please do not follow social media. Do not follow Google in health. Follow where what the doctors are saying, what the science is saying, what the creditable websites are saying,
Mm.
right from a World Health Organization to our own National Institute of Communicable Diseases to
Yes.
higher health to Department of Health. So
Mm.
please, please, please learn from this. But what we are going to do is, Dr. Fundi, we are building 10,000, and our own minister and deputy minister have wanting to build something called COVID warriors. We have our own peer educators, and we are transforming them with education towards understanding vaccines and be our transforming agents to a peer-to-peer influence when we start this drive. And we encourage, when the phase 3 comes or the phase 2 comes, and when your Q number comes, we want the population, because that's the only way we can overcome this deadly virus. Thank you.
Yes. Well, no, I'm quite impressed with that, Doc, because, and the reason why I am, because once again, we have there's a general thinking out there, young people, they don't see themselves as being at risk, and young people are into social media, and they are getting into contact with misinformation or disinformation, and people are assuming that young people will be hesitant to take the vaccine. But if you use their peers and you empower the peers with authentic, scientifically proven information, then it will go a long way towards convincing those who were not yet decided that actually there's more benefits from vaccination than not being vaccinated. And it's not only about helping yourself, but it's also about helping others. It was the more we are vaccinated as individuals, the more we are edging closer to that, population immunity, or what other people call herd immunity, and the more we'll protect our family members, the elderly and people like those, when we go home during Easter, So one must think beyond themselves when it comes to the issue of vaccination. And another issue that, a lot of people have been worrying about has been the issue of side effects. I was very glad to read on a report that was issued by Professor Rees about the side effects on the healthcare professionals to date. And in fact, today, what is the 13th today? I think it's the 13th. But anyway, so we started vaccinating in South Africa on the 3rd of March. So we are just over a month into vaccination. We've had 145,215 healthcare workers being vaccinated. Prof. Rees was talking about 2 days ago. And what was good in her report was that there hasn't been any major adverse reactions. There's a few people who had allergy to the vaccine who were admitted for observation overnight, but within 24 hours they were released. But the majority, the overwhelming majority of the people just had mild headaches, soreness of the arm, just where they were injected, and some, painful body. But within 24, 48 hours, all of those things were gone. And I think it's going to be important then for us, and I'm now saying for us as the healthcare community, to actually use that information to say, when the studies were done, maybe 40,000 people across the world, but now we've got 145,000 people as of yesterday who've taken this vaccine, and not even one has had anything major, as a way of encouraging people that this is something worthwhile doing for yourself, for the nation, and so I just want to wish you, as Higher Health, all the best in terms of getting the young people to actually embrace vaccination as the only tool within our medical arsenal that is proven to deal with pandemics like this one. Now, as we wrap up, Doc, what closing remarks do you have, around COVID-19 or any of the issues that you addressed in your video?
One closing remark is first to congratulate once again to all these young people who have, among difficult times last year, still fought hard and made it back into the post-school system or new coming into our post-school system. I think they deserve a severe congratulation, a huge congratulation from us. And we're very proud of you. You are going to take our country and your own families forward in building skills and nation building from your perspective. I'm sure your parents are equally proud, or your guardians are proud, or your family is proud, and so are we, and so is your community. But on the other side, I appeal to you that you look after your youth epidemics, the ones which we discussed today. Be able to know your surrounding, be able to understand your surrounding, and not be blown away or taken away from the beautiful future that you have in front of you from some small mistakes that can happen in this tender age of yours in an environment which is highly vulnerable and is a kind of a microcosm to these epidemics in our communities. Your unbound freedom should not be the reason for your failure. It should be the reason for your success in your early adulthood. My aim is for you to please join higher health curriculum, become our ambassadors. We need more young South Africans, educated young South Africans, to transform South Africa to the peer-to-peer influence. In fact, we need more now because of our COVID pandemic. As Chair, you have rightfully said that we cannot win this pandemic without a peer-to-peer network.
Yes.
And I echo your words to say this is a platform I call on them to become those peer educators, the peer informers, the peer transformation managers, or our teams. Because I call you managers at a very young age because we want you to manage a pandemic like COVID-19.
Yes.
Your community headmen in your villages, your family, do not shy away to not speak about these youth pandemics and COVID when you go back to your home. Talk to them. Not everybody is privileged to be in post-school system. You are. And you can change a lot of your siblings and your cousins and your family who are in school, who are out of school, and you can still build a nation for us. So this is not to the post-school education. This is to every youth who can help us build a nation by transforming a nation. So, Dr. Fundi, that's all I would say. And
Yes.
but lastly, the parent and guardians, we need you. You have to be around us.
Yes.
This war cannot be fought alone by higher health. It has to be fought together. So it is students, parent guardians, government, private sector, communities, and higher health. We one family against one common challenge, and that is to build our youth away from these pandemics that affect them.
Yes. Now, there's just a few comments that have come through. So, can you just, I'm going to ask my colleague to actually just read some of those comments, just to show that there were people who were listening. We're not just talking to ourselves. All right. My colleague, Nwabisa, can you please read through the comments?
Okay. Good afternoon, doctors. We have a couple of comments on Facebook. The first one says, healthy lifestyle is a key point to productive learning. And thank you for the contact, Prof. We will share it. It is from Dikele Balebe. And then we have another one which says, I like the link to a service after the young person called for help. It is from Branox. And then we have another one that says, informative topic indeed. Thank you. It is from Angelina Likalaga. And then we have another one from Melanie saying, true, Dr. Ramneek. And we have the last one from Digaledi again saying, of course, nation building is a necessity. Those are the only comments we have. Thank you.
Thank you very much. Thank you, Nwabisa. All right. Thank you very much. So, Prof, on my side, I would like to thank you for agreeing to use your family time to actually be here to inform our viewers, about the good work that is done by Higher Health. And like I said before, I want to wish you and your organization all the best as you try to create a healthier future amongst the people in your constituency. So I want to thank also all the people who have joined us on this channel, listening to us over the last hour and about 15 minutes. So we thank you for participating, those who have sent comments. It gives us encouragement that, you know, the information that we are bringing through, the experts that we are bringing through, you know, there is an audience out there that wants to hear what they have to say. So from the Dr. Fundi channel, I want to say thank you to everybody, and thank you to the support staff from the office of Prof. Ahluwalia, you know, because without them, maybe I would not have been able to have this smooth, you know, engagement where everything has been, you know, planned to the T. So thank you to you as well. All right, thank you to everybody. Until next time.
Thank you, everyone. Bye-bye.
All right, bye.